Maxim Weil, I'm an infection control expert at the company Saniswiss. So I will briefly talk to you about the company. So it's a Swiss-based company in Geneva. We were founded 20 years ago this year. And basically we develop, produce, and distribute all over the world safe hygiene solutions. So basically infection control tools such as detergent and disinfectant for infection control. The innovative position that we have is that every product that we try to manufacture is basically thought with no trade-offs between efficacy and safety. Efficacy basically means patient safety in the end, so make sure that the product is efficient to cover the threats. And safety is your safety, is to make sure that when you use a biocide, you don't kill yourself by using the product over time. Luckily, we are based in Geneva, Switzerland. And briefly, to give you an idea, so our office is on the left side of the lake, 100 meters from the WHO headquarters, and 200 meters from the Geneva University Hospital. The beauty about this is that we have tight connection with both of entities. So of course, WHO is our guideline when it comes to AMR and to every issue that you face in infection control. And the Geneva University Hospital, it's a hospital which is a bit special because it is home to Professor Didier Pittet's place. And Professor Didier Pittet, for those who don't know, is the professor worldwide who basically pushed the use of alcohol-based hand rub in every hospital across the world. So the Geneva University Hospital has an immense impact on infection control, and that helps us to always be at the forefront of the research, the scientific evidence which is pushed towards the world. Briefly, just to give you an idea, so we do manufacture products which will take care of environmental hygiene, so the treatment of surfaces, floors, and so on, hand hygiene, instrument hygiene in the CSSD department, laundry, and more. So we have a quite good understanding of the entire picture of infection control. And as I was saying before, on our product, there is a little logo, which is a safe trademark. That's basically a sign for user to make sure that when they use our product, which are chemistries, heavy chemistries in some cases, the product has been thought to leave neither residue, neither toxic issues or product that will damage your health. So this is at the core of our company. Very briefly, so we work in 80 countries in 2026, 81 now with Latvia that we just entered. And the beauty about this is that this gives us a very good picture of what everyone is doing all over the world. And you have some use cases which are very different from what we know typically in Europe. But this is a key learning for us to understand what is being done all over the world and what can be improved and what can we learn from each other, right? Because we all do things a little bit differently, but there are good ideas everywhere. And briefly, to give you an idea, we work with two partnerships, international partnerships at Saniswiss. So the first one is called POPS, so that's Private Organization for Patient Safety. So this is this one. So just to give you an information, this is the organism that created the 5th of May. So the World Hand Hygiene Day, which maybe some of you know. The World Hand Hygiene Day is a day where every hospital across the world is celebrating the importance of hand hygiene to save patients' lives. And more recently, we co-founded with WHO and some key experts in the world, the Clean Hospital Group. The Clean Hospital Group is a research group focused on studying the impact of environmental hygiene in the hospital, in the patient care. And this is what we're going to focus ourselves today, is to understand a little bit more about environmental hygiene. The reason why we want to do so is because it's the same case in Latvia, but all over the world. There is a consensus on hand hygiene, right? Every hospital in the world has a pretty good idea of what's the impact of my hand hygiene strategy. How can I save lives by providing the good care, associated care? The same for the CSSD. In a central sterile service department, we have a very good understanding on what you should do, what you shouldn't do, to make sure that everything is working properly. But for surfaces, for surface decontamination, environmental hygiene, there's no consensus. Everyone is trying to do the best they can. Everyone thinks that they're doing a good job, but there is not a global consensus. And I can tell you from experience that there is a lot to be done to improve the overall patient safety strategy in your hospitals. And so actually I'm using the same picture as Elina before, but this comes from a research paper from the Clean Hospital Group, which is basically a literature review on how to keep the hospital safe and clean. And the literature review was to say in 2021, from what I recall, okay, what's the level of knowledge that we have on the impact of the environment in the hospital? So we took all the research available, the public research available, and the conclusion is that the environment in patient care is the most undervalued and understudied part of any IPC strategy in your hospital. And the conclusion, of course, is that keeping your hospital clean is not just about making them pretty, it's about a patient safety issue. And so today, that's the status quo all over the world, right? To deal with surfaces, no matter where you're from, no matter where you work, no matter the department or the ward in a hospital, the hospital use either alcohol, which is a technology which has been developed in the 50s, can be isopropanol, propanol, or ethanol, remains alcohol, or they use quaternary ammonium compound, which is a technology from the 70s. Now, we're almost 50, we're more than 50 years after that. I think it's about time to bring something new to the market. Because those two things, they bring a lot of issues. Elina talked about some of them. I will try to be brief on this, but the first issue that we see for both of them is safety issue. And for us, this is insane because you spend your life saving people's lives. So there is no reason why you should inject yourself with toxic chemicals on a daily basis for decades. And typically in the case of alcohol, which is extremely volatile, it is very well documented that it causes, of course, respiratory irritations, headaches, dizziness, fatigue, skin irritation, and eye irritation in the best case, let's say. For quaternary ammonium compound, it's a little bit more perverse because the effects are over the long time. But overall, it has been linked to, of course, cause respiratory irritation and occupational asthma as well. The most common cases are contact dermatitis or allergic reactions, which in turn make the user want to use less the product, of course. And the latest research shows that there is a very credible link that you could absorb quaternary ammonium compound through your skin. Basically, what you absorb is endocrine disruptors. And endocrine disruptors, basically, they will mess with your hormones, which in terms will have links with fertility rate, with other different risks associated with hormones. So this is what pretty much everyone is using, and this is the risk that you have when you use those products, especially over decades of work. And the other two main points, which it's impossible to say if it's more important or not, but for alcohol, there is a practical issue, which is that alcohol doesn't clean. So in order to make alcohol work on a surface, you need to make sure that it has been properly cleaned before. So it's impossible to make sure that it has been cleaned perfectly before. Plus, there is a lot of acidity in the surfaces, meaning that having a perfect cleaning is extremely hard. So you need to have another product to work with it. And everyone knows that alcohol has a very poor material compatibility, which means that basically you cannot use it in a variety of surfaces like PVC, plastic, plexiglass, screens, and so on. And so for every time that you cannot use alcohol on a surface, what you do is that you use a quaternary ammonium compound, which is alcohol-free. But the problem with the quaternary ammonium compound is that it's absolutely not biodegradable, which means that over time it will build some residues on the surface. So this is why maybe in your hospital you have some surfaces which are sticky, which have turned a little bit yellowish. But those residues will build up biofilm. They allow for the surface to build on the proteins that you will put on the surface, which in turn will build up the biofilm, which in turn will build up the antimicrobial resistance of bacteria and other types of threats. So basically, neither of those two are what we would call an ideal solution. But the worst, for sure, for us, the worst case of all, is that the goal of those products is to prevent people from getting any type of microorganism, to prevent cross-infection. And when you look at the efficacies of both technologies, and this is no matter the brand, no matter the manufacturer, everyone is the same. If you look at both of options, the first thing that we can see is quaternary ammonium compounds have an extremely low efficacy, which is well below what a hospital should use. Alcohol, of course, is much better, but as we just said before, to make sure that you reach those efficacies, you need to clean before. So it complexifies the protocols, it takes more time, and you need to make sure that both the cleaning and the disinfection have been done properly. But more importantly, it leaves the entire spectrum of things we want to protect. It leaves some dark spaces, of course. Neither of those options are efficient against spores, such as Clostridium difficile, which is becoming more and more problematic over the years. By the way, if you see a product based on alcohol or quaternary ammonium compound that tells you it's efficient against spore, this is straight up a lie. All the evidence are clear on that neither of those options can be sporicidal, just by the way a spore is formed. But you also have issues with non-envelope viruses. You have endemic viruses like norovirus, which creates every year some large outbreaks throughout the hospitals all over the world, which are not technically covered yet. And you also have more specific issues, which are, of course, outside of the OR. But HPV, human papillomavirus, currently is a non-envelope viruses, which is spread from gynecologist to gynecologist. For the reason that if you think about the vaginal probes, you cannot use alcohol on a vaginal probe, so you turn to the default, which is quaternary ammonium compound, but quaternary ammonium compounds are not efficient against HPV. So those are common issues that we see all over the world. I didn't mention Aspergillus brasiliensis. I've seen that you have a lot of beautiful hospitals, but I've seen that there is a lot of construction going on to maintain them. Aspergillus brasiliensis is something that spreads very easily when you have construction, and yet it's not properly covered. And in addition, this is for your information, those threats, it's not that they last for a couple of hours if they are not treated. Clostridium difficile, for instance, can last up to 4 months on a surface. So it's not just, okay, I missed it, but it will disappear and so on. No, it can remain for up to 5 months on a surface. It's the same case with VRE, Acinetobacter, and so on. So the risk is quite significant over the long run. So briefly summarize today, just by thinking the big picture of the products that we are using, the status quo is not enough. We talked about safety, of course. We believe that it shouldn't be the case. Material compatibility, of course, and efficacy. So now the question is what's next? If I come back to the paper from the beginning, so keeping the hospital safe and clean, the approach is to say, okay, so then what's an ideal product? What's an ideal disinfectant? And their conclusion is to say that an ideal product would be efficient against all bacteria, all yeast, fungi, spores, enveloped and non-enveloped viruses. So today I want to teach you something which will make you become a professional of the topic, is how you can check already yourself for the efficacy of a true disinfectant. And this is something which is publicly available, but that very few people are aware of. So our job is to teach it to you. It's called the EN 14885. And EN 14885 allows you to take any disinfectant in your hospital, to check the bottle, and to confirm what the manufacturer is telling you. Because all manufacturers, including myself, will tell you that I have the best product, that you should trust me, that it's perfect. These tools, this standard, will help you to make sure that it's the reality or not. And we're going to give you an example very quickly. But basically, it's to make sure that the claims are validated scientifically. And the EN 14885 works like this. It gives for every hospital, but also every veterinary offices, any food industry offices, the tools to understand what are the proper standards for environmental hygiene, hand hygiene, or instrument hygiene. So now I'm just going to show you some example for the typical part that we want to take care of in a hospital, in an OR room. And it looks a little bit like this. So these standards tells you that if you want to make sure your disinfectant works, you need to check on the bottle. So it's quite easy to do. You just take a disinfectant, you turn, and you check if it's written or not. If you have those tests that have been passed, no matter the number, but you need to remember those. And if you have those tests, this is already a good sign for you. Those tests means that basically in the laboratory, we've taken some tub, we place some bacteria, like typically resistant bacteria that we want to try. We pour some of our product and we check in suspension whether or not the disinfectant works. And this has a barbaric name because it's not easy, but it's called a test, phase 2, step 1, in suspension. And then you have another batch of tests, and that's it. Those are those ones, and those are called phase 2, step 2. If you understand this table, you have understand everything you need to understand about a disinfectant in the OR theater. We will share you the document if you want. You don't have to take pictures. But the way those phase 2, step 2 are made, it's like this. It's the way we should test the disinfectant. If you have a spray foam or wipe, you want to test the bacteria, the mycobacteria, the viruses on a surface. Okay? This sounds super easy, but I will show you that it's not the case all the time. And this is called phase 2, step 2 in applied conditions. So of course, as a hospital, you want to make sure that the product you use in your operating room have been tested like this, because this is much trickier than just in suspension. In suspension, a bacteria, for instance, has no protection whatsoever. It doesn't need to be protected, basically, whereas this is much closer, typically, to a biofilm situation or a real-life situation. Very briefly, because this is a little bit less important, but still, both of the tests, so phase 2, step 1, phase 2, step 2, in the laboratory, you can pass them in clean conditions. That means that everything needs to be perfectly clean before, or in dirty conditions. And in dirty conditions, we're going to try to reproduce the setup of an OR. So there's going to be some added blood, some added protein, which simulate the reality of the ground. And that's pretty much it if you want to become an expert in understanding what type of disinfectant you have. So phase 2, step 1 for any category needs to have those things mentioned on the labels. Phase 2, step 2, much more educative for you, much more important for you, which you can pass in clean or dirty conditions. For all the range, from all the spectrum to bacteria to viruses, the maximum contact time should be 5 minutes. For spores, it should be 15 minutes maximum. And I just wanted to do this because yesterday I had the chance to visit 3 hospitals, which was very highly educative. And in each hospital, I have seen this product. I will not tell you which product it is because it's not important. The important is to show you an example on how you can test the quality of your product in your hospital. Now, basically, no matter the language, what we can see in the ingredients part is this is a product which is based on 72% alcohol plus quaternary ammonium compound. So ADBAC and ADEBAC, those are quaternary ammonium compound. And on the back of the bottle, so those are wipes, by the way, the back of the bottle, you see this. So it looks very good. I mean, you can deal with apparently all bacteria, including MRSA. You can deal with fungi, candida. Alors, candida is not a fungi, it's a yeast, but that's a mistake from the manufacturer. Mycobacteria, viruses, including the noroviruses, so non-envelope viruses, in 15 seconds. Plus, there are lots of standards, so the product must be amazing. This is why it's in every hospital. But now let's do the test, right? Let's do exactly what we've seen before. So I've taken the same table, which is the European requirement for every hospital in Europe, and we're going to do it in 2 steps. First, in this, to simplify the reading, I'm going to remove all the norms which are nonsense, which are not related to the use of a hospital use. So here I think we have approx 15 standards. If I remove the one which are just cosmetics of marketing, this is what we're left with. Those are the real norms that should be in a hospital. And then if we compare those to the table, this is what we have. So in conclusion, the only factual proof that this product is able to bring to a hospital is bacteria. And for the bacteria, we don't know exactly which bacteria. This is a little bit confusing, but for the benefit of the doubt, let's say all bacteria, including bacteria gram-negative, and yeasts. But for the rest, including the viruses, like the norovirus, which is claimed before, there is no proof in real-life conditions. Zero. So a disinfectant which only deals with bacteria and yeast, for us, shouldn't be in a hospital. Shouldn't be in a hospital. But when you look at the label and you see all those norms, plus the table you see 15 seconds, 30 seconds, looks magic. But in reality, you need to ask to your manufacturer, to your supplier, you need to ask for the proof of efficacy. Because as it stands, the proofs are missing. And that's key for infection control. If I come back to the first part of what an ideal product should be, so taking care of pretty much everything that we've seen before, this is what we wanted to present to you today. So very quickly, this product is now 10 years old, but it's the first time that we introduced it in Latvia. So it's called Sanitizer S1 and Sanitizer S1 wipes. And this is an alternative to alcohol and quartz. And this is based on a low-level hydrogen peroxide, 3% hydrogen peroxide. And there are, let's say, at least 5 reasons why this product is above everything that exists on the market today. The first thing is that we do the same exercise as you should ask for everyone. If we look at the norm, this is currently European-wide on the market, the only product which has passed all the standards in dirty conditions in the appropriate time. Including today, this is the only product ready to use, which can clean and disinfect, including spores, including non-enveloped viruses, in less than 5 minutes. So the idea behind this product is to stop the question on a daily basis, I should use a bad product, which is cheap, but at least it works. And when I have a problem, I use a stronger product. Because this is not prevention. When you wait for a problem to happen, this is not prevention. It's curative approach, and that's not what we want. So this is a product which will cover everything. And if I take back the quote from before about an ideal product, now this is the full quote. So not only an ideal product will have a full efficacy from bacteria to spores, but it will also have no impact on the environment as being completely safe. And the thing is that with hydrogen peroxide, the beauty of the molecule is that once it has touched the surface, it decays into 2 things. H2O2 decays into water, H2O, and oxygen. So this is a product which is 100% biodegradable. This is a product which doesn't have a volatile organic compound. So the product doesn't have any dangerous goods symbols on the label. On the material safety data sheet, there are no specificity as to how you should handle the product. And so in terms of having no impact on the environment and being completely safe, it's quite okay. And then it should be easy to use. The product is ready to use. And the product cleans and disinfects at the same time. And it's not written here, but we had a conversation yesterday, and we talked about resistance earlier this morning. This leads to no resistance. And the reason why it leads to no resistance is because the way disinfectant works has nothing to do with quaternary ammonium compound and alcohol. Because alcohol and quaternary ammonium compound, they work through a system of inactivation. So they don't kill the cell per se, they inactivate it. Whereas this works in the same way as chlorine works, which means it's an oxidative technology. And oxidative technology, they will put some stress on the cell, which will make the cell implode. So when you attack the structure of the cell that you want to kill, you cannot lead to any resistance. Whereas when you want to attack its mechanism on how to reproduce, this leads to resistance. So we believe this is a product for the future. We have seen all over the world hospital trying it in some wards in the hospital, like the OR, like the neonatal care and so on. And now we see more and more countries that have completely removed alcohol and quaternary ammonium compound to go into products like this, which will actually do a great job. So that's it for me. I hope it's clear. If you have any questions, feel free to ask.
Thank you very much. Vai, jautājumi?